Hello, everyone. Good evening to you all. Welcome to our second program. And today we are going to talk about Down syndrome. Actually, this program was created by Dr. Isik and also in partnership with Women in Management, Institute of Women in Management, Sri Lanka, especially because we have been this something that we are not discussing, and we call them special children, or just we think that they have a disability, but it's more to that. So before we proceed with the program, let me introduce to you about our facilitator, who is Dr. Memet Isik. Is an associate professor, Faculty of Medicine, University Turkey. He completed his specialty in family medicine, Istanbul Hyderabad Training and Research Hospital in Istanbul. He has experience in childcare over 15 years. He is a certified metabolic balance practitioner, and he is an associate professor of Department of Head Family Medicine. I cannot read that name. I think it's in a Turkish name. So I'll just say the University Faculty of Medicine, Department of Family Medicine. So Dr. Isik, we actually welcome you for this program. And today we will be talking about what is actually the Down syndrome on a medical term, and also for us to understand it in a practical way, type of Down syndromes and what is the symptoms of Down syndrome. There are a lot of symptoms, and also how if you're pregnant, or if you're someone whom you know is pregnant, how to identify, screen them during the pregnancy, and the treatments, what kind of treatments there are, and also how to move forward, live along with the Down syndrome. So you all can ask questions, but ensure that you put it on the chat box. And also, please mute all your speakers so that doctor will be able to give you all a more comprehensive information, and he will be doing a presentation. And I hope that you all will find this is really something that is important. Doctor, over to you, doctor.
Thank you very much. I'm trying to adjust the screen. Thank you very much. I especially want to thanks to Institute of Women in Management Group. And today we are going to speak about Down syndrome. Yes. Down syndrome, actually, it's not a genetic disease. It's a condition in which a child born with an extra copy of 21st chromosome. As you know, human being has 23 pairs of chromosomes. It means that we have 46 chromosomes. The 23 chromosomes comes from mother sides, and the other remaining 23 comes from father. But in Down syndrome, there is an extra copy. It means there is 3 copies of 21st chromosome. That's why it's also called trisomy. And this extra chromosome causes physical and mental development delays and disabilities. In these pictures, actually, it's depicted very good. I want to thanks to lab test guides too. It shows this picture depicts very good all the features of Down syndrome. In Down syndrome, there's a typical facial features. As you see here, the face is flattened, especially the nose, the bridge of nose is bright and flattened. And the children with Down syndrome has small nose, small mouth, and small chins. You can see it here. But the tongue is bigger and it's protruded out. And there is a epicondylar folds around the inner side of the eyes, as you see from here. And the eye is almond shaped. And the outer side of the eye is stand up. And as you see here, it's stand up. And there is a white spot on the irises of the pupil, or white spot on the irises, as you see here. It's called brush field spots. In medical terminology, it's called brush field spots. And the hypoplastic ears, there is, as you see, the ears of the children with Down syndrome is typical. They are small and folded. The upper side is folded, and it's hypoplastic. It's called hypoplastic ears. And another feature is though there's a gap between the first and second toe, as you see here. And the foot and hands of the children are smaller than the normal children. And when the child born, the fingers are pink in color, and generally the fingers inverted inside to the other fingers. It's inverted to the thumb. And this is called clinodactyly. As you see in genetically, it's showed here, there is 3 copies of chromosome 21st in Down syndrome. Actually, there is 3 different forms of Down syndrome. I will speak on later. One of them is translocation, it's showed here. Translocation means whole chromosome 21 or some part of the chromosome 21st may be added to other chromosomes. For example, here it's translocated to chromosome 22, as you see here. And sometimes it may be translocated to chromosome 12 too. In the elderly people, the tongue shape is very different. As you see, it is depicted here. The tongue has a fissure on it, very deep fissures in adult persons with Down syndrome. And the neck is very short. It's depicted here. The neck is very short. And there is a nuchal fold. It's called nuchal fold here. There are some extra folds at the back of the neck. And these are the common features I try to explain. And the children with Down syndrome has very poor muscle tone. They cannot hold themselves up. And due to this poor muscle tone, sometimes hip dislocation may occur. And the joints are very loose. And their height, they are short in height as a child and as adults. About 6,000 baby born in each year in the United States. It occurs nearly 1 in every 700 babies. Most of the time, Down syndrome isn't inherited. It's not a genetic inherited disorders. There's a problem in chromosome separation. There's a mistake in cell division during early development of fetal phase. So we cannot say it's a genetic disorder. And there are, as I said, there are 3 types of Down syndrome or trisomy. Trisomy 21st to 21 is nearly consists of 95% of all trisomies, all Down syndromes. In this form, there is extra 21st chromosome in all body cells. In all body cells, there is an extra chromosomes. This is called trisomy 21. The other one is translocation Down syndrome. It consists of about 3% of all Down syndromes. Translocation, I tried to explain some part of the chromosome 21 is translocated on to other genes. It may be related or bound to chromosome 12 or 22. And the third one is called Mosaic Down syndrome. Mosaic means mixed Down syndrome. There is extra 21st chromosome in some part of body cells, not in all body cells. So it's maybe a little bit better. It may be a mild form of Down syndrome. The physical appearance may be same, but the mental performance is much more better in this mosaic Down syndrome form. But unfortunately, it consists of only about 2% of all Down syndromes. Actually, we do not know why Down syndrome occurs. What is the reason of this malformation, gene separation? There is only a few things that we know about it. The mother's age is very important. As you see in this graphic, as the mother age advances, the probability of having a child with Down syndrome increases dramatically. It's less than 1 in 1200 live births when the mother is at her 20s. But when the mother age advances 35, then it dramatically increases. It nearly 20 folds increases. The mother age is the most important factor here. And the other factor is being carrier of the genetic translocation. You know, the translocated gene may pass to siblings. So it may be also the cause of having Down syndrome. The third one is having one child with Down syndrome in the family. If there's a child in the family, then we should be very precautious about having other additional child. And during the pregnancy, the woman should be followed very closely. There are two kinds of tests in the evaluation of Down syndrome. The first group test is called screening test, and the other one is called diagnostic test. The screening test, sometimes we perform triple screening test, or sometimes quadruple screening test, or quadruple screening test. We take some blood sample from mother, and we examine alpha-fetoprotein, human coronary gonadotropin, estradiol, and sometimes inhibin A to evaluate the probability of having children with Down syndrome. This test, the screen test, doesn't definitely show the results. I mean, they are just for screening. We perform this test in order to evaluate the probability of having a child with Down syndrome. If there's a high probability, then we need to perform diagnostic test. We do not perform this diagnostic test to all the women because these invasive procedures. They may be dangerous for the child and for the mother. One of them is amniocentesis. We are taking a small sample of amniotic fluid. We take a small sample from the amniotic fluid. Amniotic fluid is the fluid in which child swim in the womb. It surrounds the child. And the other one is coronary villus sampling. We take some sample from placenta. This is an invasive intervention, so it may be dangerous for child and may cause abortions, early abortions, and for also mothers. And the third one is percutaneous umbilical blood sampling. Umbilical cord is the cord which connects mother and child. And we take a small sample of the blood from the umbilical cord. We search for the genetic variations in these materials. If this test can be performed after between the 15th to 18th weeks of the pregnancy. If we determine, if we have any suspicion, we will inform the family about the situation. And if the family accepts, they can continue to have to pregnancy, and they may have a child with Down syndrome, but the family should agree with this problem. Otherwise, if they want, they may have, if it's less than 16 weeks of pregnancy, they may prefer abortion. And there are lots of other health issues related to due to having trisomy. Nearly 75% of all children with Down syndrome has hearing loss, some degree of hearing losses. And nearly 70% of the people, of the children, have obstructive sleep apnea. Sleep apnea is a state in which a child cannot take regular breath during a sleep. So it may be a dangerous situation. And the ear infection, actually all kind of infection is increased in children with Down syndrome. The immunity is, there's an immunity disorders, and or the body's immune system is depressed. So every kind of infection is increased in children with Down syndrome. And the eye problem is frequently seen. Nearly 75% of the children with Down syndrome has a refraction errors problem, and they need to be treated by using glasses. And the heart defects present at birth. Nearly 50% of the patients with Down syndrome, of the children born with Down syndrome, has heart problems. And most of the time, the atrioventricular malformation is seen. And this is quite a big burden to family and for the child too. And this heart problem increases five times the health expenses of the child. And the hip dislocation is frequently seen. Actually, this hip dislocation is due to decreased muscle tone. Muscle is not enough strong to keep the hip in its original location. And another most frequently seen condition is anemia, especially iron deficiency anemia, frequently seen in patients with trisomy. And obesity, and in the elderly period, obesity also frequently seen. Most of the time, the children becomes obese people when they grow up. And there is 1% of having leukemia in lifelong in their life. I mean, nearly 1% of all person with Down syndrome will have leukemia in their life. And there are different endocrine problems, especially hypothyroidism is frequently seen, dental problem, and epileptic seizures. This kind of seizures is frequently seen in children with Down syndrome. In older adults with Down syndrome, the possibility of having Alzheimer's disease and dementia is quite high. And the lifespan is, comparing to normal person, lifespan is also is less than the normal population. And it's nearly 60 years nowadays. Actually, before 1977, the expected lifespan of children with Down syndrome was around 10 years of age. Private insurance costs is nearly 12 times higher in children with Down syndrome in the United States. You know, the money is very important in the United States, and the health insurance cost is nearly 12 times is higher for children with Down syndrome. And children born with Down syndrome and have a heart defect has 5 times more health expenses. And nearly 60% of family cannot afford to supply health expenses in hospitals. So 60% of family provide health care at home. Over 40% of the family members who stopped working because of the child's condition. I mean, they need one family member need to give full of his working hours for the child. So it's also becomes an economic burden on the family too. Unfortunately, there is not known treatment for Down syndrome, but of course there are some services that can increase children's ability to adapt to normal society. Down syndrome is a lifelong condition, unfortunately, and the services will improve their physical and intellectual ability. For example, especially speech therapy, occupational therapy, and physical therapy are very important in the development, especially in the early period of childhood development. In most of the countries, children with Down syndrome attend in normal school classes, but many children require special attention and private help. So otherwise they cannot cope with other children or other peers. Down syndrome is a condition in which we can give some services to supply to make better outcomes. And I want to get your question. Actually, this is the basic things that I can speak about Down syndrome. If you have any question, please, you can ask your questions.
Thank you, Dr. Memet, and ladies and gentlemen, you all can type on the chat. So I have got 3 questions which has posted me privately. Question is, you said Down syndrome test is dangerous. Mother and child can be dangerous for mother and child. Can you explain it a bit?
Actually, as I said, there are 2 type of tests for Down syndrome. The first line is screening test. These screening tests are not dangerous. We take a small amount of blood from mother, and we examine this for the alpha-fetoprotein, human chorion, estradiol, and this is not dangerous. This is screening test, but this group of tests, this test doesn't definitely show that the child will have Down syndrome. It only tests the possibility of having Down syndrome. If it shows a high possibility, then we need to perform diagnostic tests. The diagnostic tests are invasive tests. It means we interfere, we enter pregnant woman's womb to get some samples. The samples are, one of them is amniotic fluid. We take a piece of amniotic fluid through a long needle. It may be performed over the umbilical, over the symphysis pubis. We enter into placenta and take amniotic fluids. And the other one, we get a small piece of tissue from the placenta. You know, the placenta is a structure which supplies blood and oxygen to child. So cutting by a needle may cause early abortion. This is the most expected side effect.
Okay. Dr. Memet, can you put the first page, please?
Okay. This one?
No, the start. Yeah, that would be enough. No, the first one. So there is another question. You spoke about physical therapy. Yes, physiotherapy helps the child in major way. Am I right? That's a question.
That's true. Because the muscle tone is very weak in these children. Muscle tone is very weak, especially in the early developmental period. Physical therapy strengthens child muscles. So it will keep child's hips in its location. Otherwise, there will be hip dislocations. It's another problem. And the hip location is difficult to treat in children with trisomy, with Down syndrome.
So that means their bones are not tight enough. Am I correct? Or their structure is not very much solid?
The muscle tone is not strong. Muscles is weak, so it cannot hold the body structure firm, and all the joints are very loose because the muscles are not strong. All the joints are very loose in children with Down syndrome.
Okay. There is another question which is says what kind of support we could provide for children who are in really childhood development stage, especially on preschool age.
As I said in this slide, during the language development period, language support is very important. The children should get private education on language development. They should, that their intellectual level is very low. Their IQ level is nearly about 50. It means that an adult uh, patient with Down syndrome whose IQ is about at the age of 7 to 8 years of normal children, IQ level. So, and in the early periods, in order to develop their IQ, also this kind of therapy, the speech therapy, occupational therapy, is very important. Uh, they increase their intellectual ability, and they increase the coping ability with the normal populations.
Okay.
The educational support is very important. There is not a medical support. The only thing is to give private education, if possible, private school teachers or one of the family members should spare all of his life for that child. Otherwise, life will be very difficult. Let me explain these things. Before 1977, the expected age of the children with Down syndrome was only 10. It's now increased up to 60. Normally, children with Down syndrome can live up to 60 years of age
Oh,
nowadays. But before this 1977, population didn't give enough time to spend their intellectual development. The intellectual development is very important in for the coping with normal life. I mean, if they don't have enough intellectual development, their lifespan also will be decreased, and they will have lots of other health issues, as I spoke before in this slide, for example. There will be lots of other health problem with Down syndrome. As you see, all are the major health problems. If you don't give enough attention to children's health, or if you don't give enough treatment for specifically for these diseases, then the lifespan will be short.
okay. There is a question which asks autism and Down syndrome, is it different or is it same or two words?
Actually, all the external physical appearance of all three type of Down syndrome are same. Some may have severe mental problem. If, for example, if it's pure trisomy, in this type, there is an extra chromosome in all the body cells, and they may have lower mental function. I mean, the mental retardation may be severe in this kind of syndrome. But the external appearance is nearly the same. The facial appearance is nearly the same.
Okay. The child was born normal, but at 6 months he got fever and now he's 4 years. Doctor says he has Down syndrome. Can this happen?
No, actually, Down syndrome cannot. It's it occurs during the early developmental period in the fetus. In the fetus, a child cannot get Down syndrome after birth. Probably they didn't notice this Down syndrome before the age of 4. The
Okay.
child had Down syndrome before, but they didn't have any test. Actually, now genetic testing is very easy to perform in the children's. They can go to a university clinic to have this kind of genetic test to prove it. It's very easy to prove if the child has Down syndrome or not. Actually, external physical appearance is very typical. They can look at their children's face. If they have these characteristics, see here, for example, let me show, for example, yes, as you see here in these pictures, this is very typical face of a girl with Down syndrome. Small nose, and the eyes are very typical, and there is inner epicondylar fold here, and their mental function is low, and their neck is very short. And for example, here, if they children has a spot on the iris, it also may show Down syndrome. It is typical. Any doctor can detect Down syndrome easily just by looking at the children's face.
Okay, then there is another question. Can children with Down syndrome live full lives without the support of their parents or an external party in the future?
Actually, it's very difficult. It's not possible, I can say. Community support needed. Or government may support this kind of services, but without giving a good education, the life span will be very short. They should be cared. They depend on the other people. Otherwise, they cannot live alone. For example, after the age of 15 or 18, if we didn't give a good education during the early childhood period, they cannot continue to live without any support.
Then they say, why do Down syndrome children get angry so soon and they express their anger with with strong facial expressions and also hitting others? Is it common or is it only for specialized Down syndrome children?
Actually, children with Down syndrome cannot express their feeling verbally. Most of the time, they cannot express all of their need just by verbal communications. So they apply this kind of aggressive behaviors. It's not this kind of behaviors doesn't show Down syndrome, but it's frequently seen in children with Down syndrome. Did you
Then,
understand me?
yeah, what I think what the mother is asking is there a way to control the anger or the physical
Yeah,
thing?
ways. Actually, if we give a good education during the early development period, this kind of aggressive behaviors will be less. I
If you
mean,
can
during the early,
explain to them what is the early education you mean,
I,
they
I
know.
mean, the early education, the child should attend at special groups, a private education. They need to learn in a circle in which a private teacher who is experienced with studying children with Down syndrome. This is very important. And there should be some other, in the circle, the study groups, the children with Down syndrome may gather and they try to adapt with the other children's. And this is important in the early childhood period. I mean, in the second year, third year, fourth year, this is very important. And if they now cannot control these aggressive behaviors, they can get professional support from a child psychiatrist. They can use some therapeutic medicines to control their aggressive behaviors. They can use some herbal supplement to, I think in Sri Lanka, there are lots of herbal supplements. They can use this herbal supplements to calm down the children's. It's better to ask psychiatricians, especially for child psychiatrists, to get some professional support to calm down the children with aggressive behaviors.
So what you mean is that early childhood is the child should be familiar with group of similar children as well as normal children, so that the behavior can be changed. That's what you are
Yes,
advising.
this is important. Yes,
Yeah.
yes,
Okay.
this is important. If the child grow alone without having any contact with the other children, most of the time these kind of children becomes very aggressive. They cannot develop enough language ability. They cannot express their feeling verbally. So they show their needs just by showing anger. I think
Right.
this is
So
clear.
another question in the Facebook: are all Down syndrome children have the similar appearance?
Yes, that's true.
Right.
Yes.
Then there is another one which is how does Down syndrome affect the life of an adult?
Uh, as I said, their intellectual level is not always compatible with normal person life. They cannot perform every kind of work. For example, some of the Down syndrome, especially the mosaic forms, can work can perform their job, some basic jobs, except not every kind of job. For example, they can work as a waitress in a restaurant. And actually, in Istanbul, there is a restaurant, and all the workers have Down syndrome, and they are coping very good. It's this project is supported by government, so this kind of job facility can be supplied by government, uh, but not all Down syndrome adult can do the same job. Some of them have very really severe mental problems, so they cannot work in normal. They cannot work. They need always support.
Okay. So
And of course, there are lots of health problems with Down syndrome. Uh, for example, the infection is very big problem,
okay.
and the cardiac problem, eye problems. These are very important. They affect their life, and they make their lifespan shorter. And this is important to give support.
Right. Then there is another. This says what kind of things as teachers should know when they are having Down syndrome children as students in their schools.
Sorry, I didn't understand.
Uh,
What
uh,
kind of?
what kind of things they should take account when working with all children together. The teacher is asking, she has 20 children in a preschool and Down syndrome child also, so what type of things they should change with the normal and the Down syndrome children?
Yeah. Actually, the children, there should be teachers who has educated for the children, for the education of children with Down syndrome. I mean, the teachers should have private special education for handling Down syndrome children's. Uh, they should not expect, for example, they should not expect homework to be fulfilled by Down syndrome children. They cannot fulfill their homework totally. And they cannot perform every kind of skill that perform normal children's. So they should not force the children with Down syndrome to fulfill all the homeworks, all the jobs. They just try to to make the children to contribute this education media to take part in the activities, but they should not expect any success from these children's.
So
They
it's
should not force them to
participation
do.
matters than the gradings, right?
Pardon?
Participation of these children matters.
Yes, participation is enough. It's a success for the children. Just participation is enough. It's not necessary to fulfill everything as it requires. So the participation and making them occupied with these homeworks, for example, may be important. And the children with Down syndrome, generally they are interested interested in colors and paintings, and this kind of things. This kind of activity may help them to calm down and to participate in group works. And for example, they cannot express, most of the time they cannot express their feelings. So the speaking may be difficult for them, but painting may be very good for them. And they may get bored in group activity if a long time required. They may get easily bored. So we can frequently give them a pause, short breaks for them. For example, normally school teaching hour maybe 40 minutes in Turkey. I don't know how it is in Sri Lanka. The 40 minutes is very long time for children with Down syndrome to sit at same place. So they can move in the class, and they should not interfere with the children in the situation.
Right. Thank you. Any more questions you all have? You all can type it here. And there is another question which came the from the Facebook. It says, what type of classroom environment should educator form for children with Down syndromes? What they're asking is, use the same classroom, same room for a normal child and a Down syndrome child, or a room with fill of colors? Is there anything like that specialized for children?
Yes. Actually, as I said, not all children can attend a normal school class. Not all the children with Down syndrome can cope in normal classroom, but some of them can cope. Especially the colorful things make them happy. And the sitting in down, I mean, not in chairs, sitting in down may make them happy. So they can accept playing in ground, not in sitting on tables. So if children, if possible, they can make a corner where children can play on the ground with some toys, for example, some colorful things. If the child get bored, they can go there and play on ground. This may help to calm down. We should not expect that we will give same education to the children with Down syndrome. We should accept this. This is a reality. But with private education, some children with Down syndrome can get enough abilities to cope with life. They can go to perform some ordinary works, which doesn't require high skill. For example, they can be painters. They can paint, but they cannot alone. They cannot work alone. They can perform only these things in a group environment. So in the work, if a person with Down syndrome will work, they should be supported by the work environment too. I mean, they cannot handle, they can work alone. And they always need support. They can contribute to society but they need also help from the other people.
There is a one question which is says, can Down syndrome treated early stage in the womb if they have, if a pregnant woman being diagnosis having going to give a delivery to a Down syndrome, can it be without aborting it? Can it be treated to become a normal child?
No, unfortunately, not possible. It's not possible to treat. It's not a treatable disease. It's not possible. And I want to say something. The fertility of the Down syndrome, it's very maybe important. You know, the nearly only 20% of the children of the adult with Down syndrome can be fertile. They can have child. Only 20% of the male. But one study showed that 50% of the children, of the girls with Down syndrome, ladies with Down syndrome, may be fertile. The fertility is very decreased, especially in the males, and their testicles are very small. This may be one reason. Also, some author says that they don't act to perform sexual intercourse. Males don't know these things to perform sexual intercourse. This may be some other reason. Some authors claim this. But nearly 50% of the women with Down syndrome may be pregnant if they have conceived by a normal person.
Okay. So what it says is a boy with Down syndrome has less fertility, this thing, but a girl
Less
with
than
some
20%.
less than 20. But girl, that's why when a Down syndrome girl is get raped, that she get pregnant because their fertility level is
And,
bit high.
and
Okay.
50% of the girls, of the children born by the woman with Down syndrome, 50% of the children will also have Down syndrome.
Okay, their children also. Right. Okay. So if what a great session. If there are any more questions, you all can forward it. I'm getting it from the Facebook and also from chat and from LinkedIn. That's what I'm putting it on. But you all can consult Dr. Memet Isik on Consult Health Specialist website. And also you all can have if you all want to have any second opinions about anything related to health, issues from international doctors, you all just need to log into consultant specialist and request for a doctor, and you all can see the list of doctors there who are from worldwide. So for a second opinion, you can always have them, and also you can consult any of the world recognized doctors on consult health specialist. Dr. Memet, I thank you for very much for giving these immense knowledge to us, because in Sri Lanka especially we are still we are new to this, and now only all the things are being coming in order. That's why a lot of teachers are being more teachers and parents came as participants, because this is something the country is giving attention now. And thank you so much. And participants, this will be there on the IWIM Facebook, and YouTube also will have a recording. If you all want to share with anyone, and if you all want to go through it again, you all are free to go through this. And thank you again, Dr. Memet. And as Dr. Memet said, it's nothing that it happens after birth. It happens during the birth. So, and he also said age matters a lot. So think about it when we get pregnant. And also it's something that you cannot reject, and you have to accept. And they're also special. The children are also special. You don't need to make them with good grades. Just accept them and be different to them, with not about giving them maths. Or I've seen children being taught on maths where they are not ready for that. So make a place for them, accept them, and I think then everything will be okay. And but they need help. Don't ever forget that they need help, and we need to prepare for that. Dr. Isik, you can if you can do a final summer up for the audience, that would be great.
Thank you very much. Actually, you summarized everything very clearly. And we had you made a very good summary. So there is not any additional things I can add on this summary. The important thing, especially I can give a suggestion to ladies, if they want to have children, they should plan before the age of 35, even before the age of 30. After the age of 35, the probability of having children with Down syndrome increases 20 times. So it's very dangerous. And if especially they cannot afford this kind of test, I mean, it's difficult to have this test. For example, here, as you see, how dramatically it increases after the age of 35.
Yes. Yeah.
So I recommend all the ladies to plan their children before the age of 30. That's the takeaway result.
Okay. Thank you very much. And
Thank you.
participants, thank you.
Thank you. Thank you very much. Bye bye.
Okay. Good night. Bye bye.